So today I'm going to talk about antimicrobial resistance or AMR. So at some point in our lives, most of us have used or will use antibiotics. These medications have become so common and so embedded in modern medical practice that it's difficult to imagine a world without them. Yet, there is a growing threat to the effectiveness of these life-saving medicines. And that threat is antimicrobial resistance, or AMR. You may have heard the term, maybe many people have, but antimicrobial resistance is often understood only in vague or simplified ways. In reality, it's a complex, multifaceted phenomenon with significant implications for human health, animal health, even food systems, and the environments that we all share. So, to understand AMR, it's useful to start with just a basic clarification of what antimicrobials are. Antimicrobials are medicines that are used to prevent or to treat infections, be it in humans, in animals, or even in plants. In the family of antimicrobials, there are antivirals that we use to treat viruses, antiparasitics that we use to treat parasites, antifungals, which are used to treat fungal infections, and antibiotics, which we use to treat bacterial infections. So the rest of my speech will mostly pertain and mostly focus on bacteria and antibiotic resistance. But the umbrella term antimicrobial resistance will be used. It's just because they have similar mechanisms and dynamics. I may also talk about drug resistance or what we call superbugs that we often hear in public discourse, and it just describes a similar underlying issue. So, antimicrobial resistance occurs when a microorganism develops mechanisms that allow it to survive exposure to a drug that would normally kill it or prevent its growth. When we talk about bacteria, resistance can emerge in only one class to only one class of antibiotics or to multiple classes of antibiotics. So that means that one type of bacteria can become resistant to one type of antibiotic or to multiple antibiotics. There are even some extreme cases where bacteria become resistant to all available treatment options. When this happens, we say that the infection is extensively drug resistant, or XDR. This process has huge consequences. It's true, because resistant infections are a lot more difficult to treat. It costs more money to treat them, and and a lot of the times, it requires longer courses of care. They are associated with greater physical suffering, longer hospital stays, and increased strain on healthcare systems. In some cases, the infection becomes untreatable altogether. And this really limits our collective ability as a society and as as the world to manage bacterial disease. Well, of course, antimicrobial resistance can happen naturally through the natural evolution of a microorganism, a germ, or a bacteria. But recently, its spread has really accelerated, and to the point that it's become a real public health issue. And the reason why it has accelerated is because of human behavior. While it's true that we have adopted practices that expose microbes unnecessarily to antimicrobials, there are other practices that facilitate the transmission of resistant bacteria. All of this plays a central role. So, in that sense, the problem is not really the existence of antibiotics, but the problem is how we use or even misuse antibiotics, and also how antibiotics are distributed in interconnected systems. I want to make it clear antibiotics are essential. Every day they save lives. There are many situations in which antibiotics are absolutely necessary, including in pediatric care, surgery, cancer treatment, and of course, the management of serious bacterial infections. So the difficulty is to reduce unnecessary use of antibiotics, ensuring that antibiotics are prescribed appropriately while preventing the spread of resistant bacteria and organisms. So, why is it so important? Well, to answer that question, it's useful to become aware of how microbes and microorganisms, including bacteria, become resistant to antibiotics. Well, of course, you probably know that the human body contains billions of bacteria. Most of these bacteria are harmless. Some of them are even beneficial. Bacteria reproduce very quickly. When they reproduce, sometimes there are random mutations that happen. Some of these mutations have no effect. Some are detrimental to the bacteria, and other mutations provide a survival advantage to the bacteria. It happens that a mutation enables bacteria to tolerate exposure to an antibiotic without dying. Some bacteria develop some mechanisms that expel antibiotics from the cell. So they just reject it. It's like a little pump. Other bacteria develop enzymes that degrade the antibiotic medication before it can start harming or killing the bacteria. These mechanisms can arise in both harmful and benign bacteria. So when resistant bacteria, so bacteria that have acquired these mutations that help them resist the antibiotic. So when these resistant bacteria are transmitted to another host, another person, especially if the bacteria is pathogenic, then it makes the infections much harder to treat. So I'll I'll start again. So the bacteria in me would mutate and then would develop a resistance to an antibiotic. Then I would meet someone and transmit them my bacteria that has become resistant. And that's how antibiotic resistant bacteria start spreading in the population. Well, when we prescribe too much antibiotics, we run the risk of accelerating these processes because we selectively, this is just evolution, eliminate the bacteria that could be killed by the antibiotic. And we would allow the resistant bacteria that have a survival advantage to proliferate. This is why it is so important to reduce unnecessary exposure if we want to prevent antimicrobial resistance. There are many reasons why we prescribe and we use too much antibiotics. In 2020, a study was conducted in Canada, and it led to the conclusion that nearly 1/4 of all antibiotic prescriptions were written for infections that rarely or even never require antibiotics. In children, this proportion was approximately 1/4, even for viral illnesses like just a common cold, which is normal in children. There's another risk with prescribing too much antibiotics, and it is to prescribe the wrong class of antibiotic, prescribing the wrong dose of antibiotic, or prescribing a treatment that is just too long. Sometimes doctors prescribe antibiotics for conditions like an ear infection, but we don't need an antibiotic to treat an ear infection. A lot of the time, they just cure themselves. And sometimes they are even ineffective for these diseases. There are some settings that are particularly good for the proliferation of antimicrobial resistance, like hospital or long-term care facilities. But we also have evidence that show that infection prevention and infection control measures can really have an impact. For example, the rates of uh, antibiotic resistant MRSA, it's just a bloodstream infection, acquired in healthcare settings, have declined substantially when in these settings we improved hygiene, surveillance, and infection control practices. This demonstrates clearly that resistance is not inevitable and that targeted interventions can be effective. We also have diagnostic tools that can play a very important role. I'm talking about things like rapid tests for some infections that can help us distinguish between a bacterial and a viral infection. That can reduce unnecessary prescribing. It's also important to talk about the pressure that doctors and other prescribers are under. Sometimes doctors have limited time, patients have limited access to care, and patients can have very high expectations. All of this can contribute to prescribing too much antibiotic. Recently, another study conducted by Health Canada showed that people made their health decisions based on the advice given by a healthcare professional, like a doctor or a nurse. This is why it's important that there would be clear communication about risks, about benefits, and about alternatives to prescription medication. One approach that is gaining traction in Canada is the use of delayed prescription. A delayed prescription is when a doctor gives a patient a prescription, but tells the patient, don't go to the pharmacy right away to fill it. Wait a little bit, monitor your symptoms, and only go and get the medication if some specific criteria are met, like if some symptoms arise or if some symptoms worsen. This approach can reduce anxiety and avoid unnecessary antibiotics use. And it also gives patients the feeling that they are safe and that they will not get sick. In Canada, antimicrobial resistance is widespread. Indeed, it is estimated that each day in Canada, 15 people die as a result of a resistant infection. On the global scale, antimicrobial resistance is among the leading cause of mortality. In 2019, approximately 5 million deaths were associated with AMR worldwide. Among these deaths, 1.3 million were directly attributable to AMR. This means that effective treatment could have prevented them. In Canada, it's alarming to note that 26% of infections no longer respond to first-line treatment. A first-line treatment is a medication that is typically used as the initial course of therapy. So 26% of infections don't respond to that. It's alarming. It's even more alarming when we realize that there are projections that show that this number could rise to 40% by 2050. Imagine 40% of infections in Canada not responding to a first-line course of treatment. So AMR is not a distant or abstract problem. No. Resistant bacteria are being detected in every province and territory today. There are certain populations that are more affected than others, like people who stay in long hospital stays, some people who have underlying medical conditions, the elderly, infants, and young children. There is also a higher risk in people who travel a lot, in people who get medical care abroad, or people who belong to other communities. But it's fair to say that antimicrobial resistance ultimately affects everyone. But what's the history of antibiotics? Can the history of antibiotics shed a little bit of light on what is going on right now with antimicrobial resistance? So let's go back in time a little bit. So before the widespread availability of antibiotics, infections from things like childbirth, contaminated food or water, minor injuries, and routine surgeries could be fatal. Diseases like tuberculosis and pneumonia claimed millions of lives, including young adults. In Canada, in 1920, 1 in 5 children did not survive their first birthday. So the mass production of antibiotics began in the early 1940s. Penicillin was discovered in 1920 and 1928. And often we think about the discovery of penicillin like a very important breakthrough. But when we look a little broader into that story, we can see that right from the beginning of the history of antibiotics, there were early warnings about resistance. In the 1930s, there was a category of early antibiotics that were discovered and started to be used widely. They were called sulfa drugs. And just a few years after, doctors started to see emerge a resistance to these antibiotics. It only took a few years. The same thing was seen with penicillin. By 1960, most uh, infections, most staph infection, STAPH, infections acquired in hospitals in Europe were resistant to penicillin. This is why scientists had to develop a new category of antibiotics as an alternative to penicillin. This is how we got methicillin. So, this is just an example, but it really illustrates the constant race between the evolution of microbes and in a pharmaceutical innovation. It's like a race between the evolution of microorganisms and pharmaceutical products. So while we had a period of rapid antibiotic discovery, but we don't discover antibiotics as quickly now anymore. Meanwhile, microbes and microorganisms are evolving and mutating just at the same speed. Well, antimicrobial resistance is not just confined to human medicine. It's true when you think about it. Antibiotics are used in animal health and even in agriculture to maintain animal welfare and protect our food security. But resistant bacteria can spread between animals and humans through direct contact, even sometimes through food or even through the environment. Did you know that many of the antibiotics used in veterinary medicine are the same as those considered as important for human health? They're the same. In Canada, the most important antimicrobials are used for food producing animals. Uh, while all these numbers reflect the number of animals and the size of the animals, the animal consumption of antibiotics is higher in Canada than it is in many comparable countries. This is why it is so important to collaborate on working on this problem. This is why a new strategy was developed because it was recognized that antimicrobial resistance emerges and spreads across humans, animals, crops, and the environment. Resistant bacteria can circulate through hospitals, communities, food systems, water, and the soil. If we discard of antibiotics improperly, like in wastewater or in garbage, This can contribute to resistance developing in the environment. Antimicrobial resistant bacteria were detected in water systems and even in tap water in some areas. So AMR does not respect borders. And this is why it's essential that we take coordinated action. In Canada, we have a strategy that is built on 5 pillars: research and innovation, surveillance, stewardship, infection prevention, and control. Infection prevention and control, and leadership. What I mean by surveillance is to monitor the trends of resistance in some pathogens. When we talk about stewardship, it's just to preserve the efficacy of our existing antibiotics. Of course, we want infection prevention to reduce transmission. And leadership is to make sure that we have centralized coordination across jurisdictions and sectors. So, in other countries, similar efforts are led by organizations, including the World Health Organization. Their action plan just stayed the same integrated and objectives that we have in Canada. But we also have an individual responsibility, especially when it comes to prevention. We have now new guidance and new directions on the use of antibiotic. And it's normal because knowledge has evolved. So it used to be that systematically doctors would tell us take all your course of antibiotic. But now recommendations are changing. Now, the main recommendation is to follow the advice of your healthcare professional. And this person may be able to tailor a treatment duration based on your infection, based on your symptoms, and also based on the latest evidence. Sometimes it's effective to have a shorter course of antibiotic. It depends on the infection. And a shorter course of antibiotic would also have the desirable effect of reducing the risk of resistance and side effects. Every person should ask informed and targeted questions to their healthcare professional. We should not use unprescribed antibiotics, and we should also return unused medication to pharmacies instead of discarding them improperly. Unregulated antibiotic use, including medications bought online or shared between individuals like family members, carry significant risks. Antimicrobial resistance is a serious challenge, but we have tools and we have solutions. Through intelligent prescription, responsible use, infection prevention, cross-sector collaboration, and public engagement, we can slow down the pace of antimicrobial resistance.